Thank you all for coming. This is a major announcement of another wonderful Arkansas partner in the pavement reform initiative that we've been undertaking for some time now, incrementally trying to adjust the way we pay for health care in a fashion that rewards both quality and efficiency. And as you all know, we've been talking about this for some time, and various diagnoses are being incrementally added to the payment reform. And Joe can certainly answer any specific questions about the 5 that are already there, the 5 that will be forthcoming, I think, in April, and another 5 in the summer. But the basic principle, as you all recall, was that there was a recognition that the old way of paying for health care is unsustainable. The old fee-for-service model is unsustainable, and it's not something that Arkansas decided on our own. We just happened to be the first as a state to quit just talking about it and try to do something about it. And there are so many people that deserve so much credit, and I'd be remiss trying to name all of them because I'm sure I would leave some out. But I got to brag on our hospitals. I got to brag on our doctors. I certainly have to brag on our folks at Human Services. Joe, our Surgeon General, has led this effort, but he'd be the first to tell you that the broad different constituencies that have been brought in have all played major roles in this. But a significant part of it, of course, is the payor section, people that are paying for all this health care. And so in that regard, we started with Medicaid, which is obviously a payer, and something we had a little bit more control over. It was of such value, at least in its potential, that all of a sudden Medicare got involved. And then our private sector got involved in Blue Cross, and they have been a wonderful major partner throughout all this. And United? QualChoice. QualChoice has been involved and a major player. And then you've got the private sector, because a significant number of payers are, even though they have third-party administrators, they're self-insured. So they, in effect, are payers themselves. I don't know if we've got a bigger, better example of the private sector than a little company they started up there in Bentonville called Wal-Mart, that has some degree of influence not just in Arkansas and not just in the other 49 states, but globally. And so this partnership between the government agencies that are involved, the private sector, and the private business community, now further amplified by what you're about to hear from our great little success story in Arkansas we call Wal-Mart, is a further example of the collaboration that is occurring among so many different constituencies to try to get a handle on one segment of our economy that has continued just to escalate and explode, that's hurt our businesses, it's hurt our individual families, and that's the rising cost of health care. Now, nobody wants to do this in any way that impedes the quality. And so this system has always been designed, and you all have asked a jillion questions about it already, but it's always been designed to reward both quality and efficiency. And in that regard, I'd like to introduce Sally Wellborn, the Vice President for Global Benefits for Wal-Mart, to tell you what she's got in mind. Sally?
Great. Thank you so much, Governor. It's a pleasure to be here today to talk about Wal-Mart's support for the Arkansas Payment Improvement Initiative. It's a groundbreaking program, as the Governor has already described. The promise to deliver great quality care, better quality care, more transparency, and to reform the way that we pay our providers is directly related and directly aligned with Wal-Mart's approach. You know that Wal-Mart our focus is on saving people money so that they can live better, and that's exactly what this is doing. We believe that if we can apply that mindset of saving people money so that they can live better to the healthcare system, then we will all come out ahead. It will impact over 1 million people that are on Wal-Mart plans, and specifically the 58,000 people that are right here in Arkansas that are receiving health care with Wal-Mart. But as the governor said, the fact is that rising healthcare costs continue to be a challenge for Wal-Mart as well as all other employers. And so we think that we need to do some revolutionary things. And at Wal-Mart, we've done a lot of revolutionary things in retail. And this is one of our first steps in the healthcare space that will be revolutionary also. This effort that the Dr. Thompson and the governor has supported is revolutionary in its own right and will spark the modernization of our healthcare system, we believe. The APII encourages physicians to focus on the patient in the center of their care. It rewards those physicians and hospitals for better quality of care, and we'll all be better off when we eliminate things that are expensive and don't add to value, like readmissions after surgery. So what is it that Wal-Mart is doing? Well, there's a saying in rural Africa that you can go fast alone or you can go further together. And we think this is exactly what the opportunity is here. We'd like to go further together. That's why Wal-Mart is committing over $670,000 over the next 4 years and to financially support a few initiatives around the APII, and in addition to engage other large employers to participate with us. Our financial support will help fund materials that will provide information to patients about how the program works. It will help underwrite a statewide tracking system to measure the impact. And finally, it will fund the establishment of an employer advisory council that we will actively engage with the state on to help stir the national debate as well as the local opportunity, and encourage other retailers in the state to participate. Finally, and we will be working with our administrator, Blue Cross Blue Shield of Arkansas, to implement programs such as this directly with our plans that are available to our Wal-Mart associates. Governor Beebe, we respect this work. It's really exciting. It's so exciting that it's right here in our backyard in Arkansas, and we're excited about the opportunity to support this. And we are committed to working with you to look for additional new and innovative ways to address health care quality and costs for our associates, for Arkansas, and for all Americans. I believe that I'm confident that we'll figure out these models, and we'll work together to do that. So now I'd like to turn it over to Arkansas Surgeon General, Dr. Joe Thompson.
Sally, thank you. Thank you very much. Sally, let me, on behalf of our whole payment improvement team, both those in the Medicaid Department of Human Services, Blue Cross, Qual Choice, our hospitals, our physicians, our clinicians across the state, thank you for bringing your weight to what I think is a critically important point. I've mentioned before, I think our healthcare system is at a tipping point. We have providers, doctors, hospitals providing very high quality components of care, but our payment system doesn't make it where people experience a seamless continuum of care as they transit the system. So our efforts are really to improve quality, increase efficiency, eliminate duplication, and to bend the cost curve, because our healthcare system is growing and outpacing our revenues, both in the public side for businesses and families, as well as the public side for Medicaid. So this is an exciting new step. I think it's important for everyone to recognize that in our private insurance companies, frequently a majority of the covered lives or the managed lives are with self-insured companies like Wal-Mart. So if they don't come to the table to actually help bring their muscle to help transform the system, our providers will not have the amount of support they need to get over a very difficult transformation and to help take us to a new, seamless, high-quality healthcare system. So with that, I just want to say thank you. This is an important new component of our payment improvement initiative, and I think it brings one more solid support that guarantees the success over time to improve quality, eliminate duplication and fragmentation, and achieve an affordable healthcare system for our state and as a model for the nation. Thank you very much for being here.
Questions?
This may be for Ms. Wellborn. How will this change, if at all, the 1 million people that are on Wal-Mart insurance? I mean, will they notice any difference with this effort?
Immediately, they won't notice any difference. Over time, we think that it will give us the opportunity to provide better transparency, lower costs, and better quality for our associates.
And kind of a follow-up, will there be any challenges potentially with this type of effort outside of Arkansas, considering Arkansas is kind of where the state's doing
So the challenge is that we don't have everybody aligned like we do in the state, where the state is on the same page with the private employers. So the opportunity that we have here in Arkansas to be aligned will make it much easier for us.
As a follow-up to that on other states, this is something the governors have talked about and had presentations on. I first heard about it in a presentation 3 or 4 years ago on some pilot things that were going on in Boston, but it hadn't been widespread and it hadn't been adopted or undertaken on a statewide basis anywhere else. And so there's a lot of folks keep talking about it and suggest that it is good public policy going forward, but they hadn't done much about it. But the seed is already planted in a number of different jurisdictions around the country, and they're actually watching Arkansas. And obviously the federal government is watching Arkansas to see how it progresses. Now, we've been relatively slow at implementation. It's pretty complex, and there has to be the safety net down there for unforeseen circumstances that protects doctors and hospitals from complications. But the concept that a private sector, a primary care physician is going to be in charge of the total package, and that whether there are specialists involved or whoever happens to be involved, that you're going to treat that patient and make sure that patient, to the extent that it's possible, steps up and does what the patient's supposed to do in terms of their own health, and then the payment follows accordingly, is a pretty novel concept. So we've done it incrementally, slowly, so that we can iron out mistakes without hurting anybody.
I have a question about the tracking system that the money's going to go pay for. Is this going to be for Medicaid patients as well, public as well as private?
Sure. Today, we have 3 major players, maybe a 4th if you count Medicare. Medicaid, Blue Cross Blue Shield of Arkansas, Qual Choice of Arkansas, that are implementing both the episodes or the diagnostic-related payment alignments as well as the patient-centered medical home. Each of those 3 are tracking themselves for their own companies, for their own customers, how this is going. The tracking initiative that Wal-Mart Support will let us put all 3 of those together so that there is a statewide report for both the public and the private sector in one place that integrates the information from the participating carriers in Medicaid.
Other questions?
What's the status on implementing the initiative? I guess what areas have you already done this with? And what's
5 diagnostic areas have already been implemented. You want to tell them what they are?
Last summer, Medicaid implemented 5 areas. Blue Cross and Qual Choice are in the process of implementing those same 5 areas. They include, I'll try to get it right, it includes readmission for congestive heart failure. So somebody is admitted for congestive heart failure. They should be able to go home and stay home unless something happens. They don't get back to their doctor. They don't get on medicines. They don't watch their salt intake. So readmissions is a bad thing, and so that's one. Another one are hip and knee replacements. We want good outcomes. If we're going to invest in a hip replacement or a knee replacement, we don't want post-op infections. We don't want to not get somebody back in ambulatory as quickly as possible. Upper respiratory infections, to try to cut down on inappropriate antibiotic use that causes resistance to bacteria that then subsequently causes the patient harm.
You got all that, don't you?
Attention deficit disorder in the mental health arena, and pregnancy, obstetric care for the entire pregnancy to try to optimize the outcome for pregnant mothers and their newborn children. Those are the 5 that are live now. We also separately have 69 practices that are receiving extra payments to transform into a comprehensive patient-centered medical home. The requirements for those extra payments are to have after-hours clinics, to have 24/7 access, and to take responsibility for the total care experience of the patient, as the governor mentioned, so that the patients in those clinics should start to feel better coordination, less duplication, higher outcomes by the care team that's taking care of them. Those are the things that are in place today.
5 more coming in April.
5 more coming this spring. They would include gallbladder surgery, cholecystectomy, tonsillectomies. John, I'm going to have to, colonoscopies, and oppositional defiant disorder. Those are the 4 that we have actually planned, and then another 5 that are under development for the fall, which would include the cardiac arena of open heart surgery and stents, chronic obstructive pulmonary disease and asthma, as well as some other areas in the neonatal care arena also. So those are the things that will be coming forward before the end of the year.
What kind of feedback are you getting from providers about the involvement of Walmart in this tracking system? This is how they're going to be judged and taken or penalized.
Well, through your efforts, the providers will become aware of it, so I don't know what their reaction will be.
Before announcing the
Walmart being included?
Yeah.
No. Walmart is included as another payer. The providers already understand that Medicaid, Medicare, Blue Cross, Qual Choice, and this is no different. This is Walmart being included, which is a self-insured, even though Blue Cross may do their third-party administration, they are actually the folks that pay this stuff, cut these checks, because they're self-insured. And I don't know what the percentage is, but a significant number of our businesses, particularly large ones, are self-insured. And so Walmart's inclusion is very important because they represent that whole business model, that whole segment of payers that heretofore have not been included, and that's the self-insured.
But they're paying money into a system to create a tracking system that will either penalize or reward providers.
That money was...
Concern when providers at Walmart participate in this financial way.
No, we would be doing the tracking system. We just need the help for part of the money. And I can't imagine a provider would care whether it was Walmart participating in helping pay for it or whether it was Medicare helping participate paying for the tracking system. Tracking system is going to be important, period.
If I could just add, I think we have ongoing and frequent conversations with both the doctors, the hospitals, the other providers across the state. They recognize that the costs are growing beyond what can continue to be supported, and the alternatives are really much less supported by providers. They don't want a managed care company coming in and negotiating rates down. They don't want things to be extracted from their clinical practice. This is actually a partnership with providers to help improve the quality and the efficiency. And actually the model is to share the savings with the providers. So this is a revenue opportunity for providers to get it right and to squeeze the inefficiencies out of the system. And quite candidly, we think Walmart will be able to help us find some of those inefficiencies.
Dr. Johnson?
Yes, sir.
How does this approach deal with situations in which a physician or a group of physicians may have a conflict of interest and an investment in expensive electronic imaging equipment, for example, or rely on unnecessary testing for protection from lawsuits, that kind of inefficiency?
Sure. A couple of questions there. Let me try to hit both of them. First, in every one of our payment changes, we have quality metrics in place to try to guard against anybody taking a shortcut that puts the patient in harm's way. So every one of our episodes, our patient-centered medical home has performance metrics that I think will, in the transparency of the tracking report, help the press and consumers know that we are not eroding quality, and actually I think we're going to show that we are improving quality along the path. With respect to the malpractice threat, I think we have not changed any clinical responsibility of providers. We've just aligned the payment so that if the insurance companies or Walmart or Medicaid saves money, the providers get to share in that savings, and so we've aligned the incentives to get more efficiency while maintaining quality.
Thank you, sir.
How did this partnership get started? Did the state approach Walmart, or was it vice versa, or how did they decide to collaborate?
I can't answer that question. I've been asking Walmart to help us do jillions of things for years, and so I'd be remiss if I said that I called Mike Duke on the phone and said, get in the middle of this. Do you remember how it got started?
I will, yes, I do. I do. Dr. Thompson came and explained to us this innovative program that they had developed around how they were going to pay on Medicaid, and we said, this is the right way to do it. And we were excited, and we began to dialogue and learn more, and then we looked for an opportunity to get involved from the employer and the self-insured. Would you say it's accurate?
That's what we pay him big bucks for. All right, guys, girls, ladies, gentlemen, thank you.